Welcome to It Starts Within, a podcast from Platinum Performance, where we'll dive into the health challenges faced by veterinarians and horse owners alike. Join us for inspiring stories about the latest advancements in equine care, treatments, and comebacks. You'll hear interviews with elite competitors, innovative researchers, and the veterinarians that devote their lives to horses and the humans that love them. At Platinum Performance, we know the power of nutrition starts within. Hello, all, and welcome to the podcast. I am Jessie Bengoa, and I'm happy to be here today talking with an incredible veterinarian about, wait for it, dogs this time around. Most of you listening are horse people, either riders, trainers, grooms, veterinarians, but one thing that nearly every horse person has in common is that we typically have a dog that's a constant co-pilot of ours, one if not more dogs. And where you find horses and their riders, you typically find our very furry friends. So today we are digging into an area of canine veterinary medicine that has or will inevitably affect those of us with dogs, and that is their mobility. And more specifically, their joints and their soft tissue, the structures that keep them mobile. So with me today is a man whose career has centered on this topic. Meet Dr. Felix Duerr, ladies and gentlemen. Welcome to the podcast, Dr. Duerr.
Well, thank you very much. It's a pleasure being here. And, just as a disclaimer, I'm also a horse person. So we actually have 7 horses of our own. So I very well know that horse people have dogs, and there's a lot of overlap, actually. So I'm excited about the conversation today.
Oh my gosh, Dr. Duerr, 7 horses of your own. You certainly have 0 free time in your life you've established. So that's great. I mean, that's amazing. And Dr. Duerr knows the large 4-leggers and the small 4-leggers alike, but he really does specialize in small animal veterinary medicine at Colorado State University. And he really is an established authority figure in all things canine mobility related. He's a diplomate of the American College of Veterinary Surgeons and the American College of Veterinary Sports Medicine and Rehabilitation. And he earned his veterinary degree in Germany, actually, before completing an internship in Canada. You are the international man of mystery, Dr. Duerr. And then you went on to a residency at Colorado State University, and then returned back there several years later after being in private practice. So you have literally been there, seen that, done that all over the world. And we're really excited to have you here today. And I cannot wait to dig into this subject with you. And I actually got to meet Dr. Duerr. We were reminiscing about 5 years ago at the ACVSMR conference, or the American College for Veterinary Sports Medicine and Rehabilitation. And so it's really fun to get to sit down a few years later and get to dig into what you do best. And, CSU, for our listeners who are not familiar, Colorado State University, it's really an epicenter for veterinary progress in so many ways. I mean, whether you're talking equine veterinary medicine, canine veterinary medicine, or translational medicine, and we will get into that a little bit later. That's really the intersection of canine, equine, human medicine and where it all comes together. But you're right in the thick of it in terms advancing what we know, and how we treat and prevent, musculoskeletal challenges, as well as specifically joint and soft tissue concerns in dogs. So let's learn from him, shall we, ladies and gentlemen? Dr. Duerr, let's head right into it, sir. Can you paint a picture for us, if you will, of the canine joints and surrounding tissue structures that make canine mobility unique? So what are those structures at play when we think of common joint, tendon, and ligament conditions? And what role do these structures play in a dog's mobility?
That's an interesting question. So, yeah, I guess I would say what makes a dog unique. So, to me, there's 2 comparisons, right? There is comparing to the horse, and then there's comparing to a person as well. So I think there's obviously the obvious difference that for us in the dog world, for example, we see a lot of elbow problems. And obviously, being a quadruped, dogs use their elbows much different than people. And so when we talk about that translational aspect, there's maybe something that's missing there a little bit when we compare, for example, elbow disease in dogs to elbow disease in people versus for stifles, that's much more similar. Now, as far as the structures itself, I feel they are actually very similar in all of those species, but we do see maybe some differences. For example, cartilage thickness is a difference to people that are maybe a little bit not that clinically relevant. But one other thing when I compare horses to dogs that I find interesting, this might be interesting for the veterinarians out there and the MDs out there, is that I think dogs complain a lot less than people and horses. So when I talk with my friends in the equine surgery or sports medicine group here, they certainly they are quite horrified when they see the amount of arthritis that our patients have. And so that also changes our treatment a little bit, right? Because I think early arthritis is a little bit different from a treatment than very end stage arthritis. And the same for people. So, I still remember the first time I was in a OR watching a person get a total hip replacement. The surgeon, he was like, "Yeah, show me some of the X-rays. Like, what would you do with this? Because we do total hip replacements in dogs, and they do it in people. And overall, the process is fairly similar." And I showed him an X-ray of just like moderate arthritis, and he almost fell over backwards. He's like, "What? I can't believe that a dog is walking with that." Right? So from a diagnosis perspective, that's also a little bit makes it a little bit more challenging, I guess.
So it's nice to know that, our dogs have a little bit higher pain tolerance than we do. They're tougher than we are, and we're like NBA style floppers over here as humans, apparently. But that's really interesting. That's actually something that I did not know. So, and are we talking about similar structures in terms of what does it play with osteoarthritis, which is obviously very common, right, that you see in dogs, and then is the joint capsule a similar thing as what we're dealing with in horses? It's the same synovial membrane and synovial fluid and the things that are sustaining wear and tear and natural aging process, during arthritis, and then tendons and ligaments. What are you seeing there in terms of the most common injuries and disease states?
Yeah, I think that's very, very true. Arthritis is one of the most common things that we see. So in general, we separate that into primary and secondary arthritis. So primary arthritis is what we see a lot in people, like wear and tear. We just, you run a marathon every day, or maybe just once without training, and there is some cartilage degradation that happens from that. In that's very common in people, and in dogs it is less common, or at least I should say in general we see it less commonly, or people don't present to us with their pet for primary osteoarthritis as often as they do for secondary, which means because of an underlying disease. So the classic examples that everybody knows is a German Shepherd with hip arthritis. Well, why does the dog have hip arthritis? Because of hip dysplasia. Well, the same thing is true for the elbow dysplasia, and shoulder. We see shoulder OCD as an underlying reason. So that's for the stifle, obviously cruciate disease. So that's those are the common reasons why we see arthritis. We do see obviously a lot of soft tissue injuries as well. So muscle tendon tears happen. Now they can then itself cause arthritis depending on where they're located in the in relationship to the joint. There are some unique conditions, I feel, that or maybe because of the anatomy or something that we see in horses, but not in dogs. But overall, I think the categories of you see traumatic injuries that can obviously create fractures or can create muscle tendon tears, and then, like you said, arthritis. Those are probably the big things that we see. Yeah.
Sure. Okay. Wonderful. A marathon without training, that would be how I would run a marathon, and it would not be a success. So, good analogy. And Dr. Durr, how has your ability, we're talking about these injuries and disease states, but how has your ability to more quickly and accurately diagnose these conditions and these injuries, how has it evolved over recent years? Because we know that the options in front of us, for horses in terms of diagnostic imaging, but what diagnostic imaging are you reaching for in your canine patients? And what are sort of each modality's strengths? When are you reaching for one certain diagnostic imaging modality over the other?
Yeah, it's a funny question because when you said how has it evolved, I was like, I always I tell when we have interns coming through or so, then I'm always like, yeah, as an intern, you feel like you know nothing. And then you become a diplomat, and then like, 1 or 2 years in, you're like, okay, now I know everything. Then I can diagnose everything. I'm very confident. And then, when you then do this for 10, 15 years, you're like, oh my gosh, we missed that. We missed that. We don't know how to do that. So that's exactly the one of the reasons why I love being where I am, because we have so many options for diagnosing things in an objective way, and that's diagnostic imaging. And so yeah, so basically we use a lot of radiographs. So radiographs are a great first start for us. So, for example, a common example there is cruciate disease or an ACL tear. When we see in a dog stifle, when we see a joint effusion and arthritis, 99.5% of the time, that's a cruciate tear. So we don't really need to do what they do in people, is do an MRI, because in surgery we can inspect the meniscus. There's lots of reasons and lots of opinions on this why you might want to do an MRI before. But bottom line, for a cruciate tear is an example where we generally don't use any advanced imaging. So then another example would be a shoulder problem. So the canine shoulder, we do see a lot of soft tissue problems there. So biceps, supraspinatus, tendinopathies are quite common. So there we frequently use the combination of X-rays and ultrasound. Ultrasound is fantastic because it's no radiation. It's fairly easy to do. Now, it's not easy to do it well, so you need to be very well trained to get accurate and reliable results. But it's minimal sedation, and so it's a great tool. And combining that with X-rays usually gives us a pretty good idea of what's going on in the shoulder. Now, if we talk elbow, for example, that's a complex joint, and we're looking for little fragments. That is generally where we will go to a CT scan. Now, CT scans have gotten so good and so fast. I mean, for us to do a CT of the whole body is like 6 seconds or something like that. So we basically, we sometimes then we're like, if we do have a dog that has a forelimb lameness, we just say we do a forelimb CT, and then if we see anything in the shoulder, we combine it with an ultrasound. So then for complex soft tissue problems, when we're running into something where we're not, like, they're maybe out of the ordinary a little bit, or we need to get more information on a localized area, then we will go for an MRI. Just the downside of MRI is just more time, and then the dogs are under general anesthesia for longer, and also more cost. And then the other tool that we love is we do have a pet CT, which is quite awesome because it can help us sometimes when we are struggling identifying a localization. It can help us pinpoint us to the area of interest. We still have lots to learn. There's some really great work done in the equine field there. Yeah, so those are kind of the tools that we reach for.
Amazing. And do you find yourself using, multimodal imaging or an imaging stack on many cases? Is that necessary as much in dogs? Where, for instance, you're doing an ultrasound and a CT or a radiograph and an MRI or what are you doing that? I mean, is that happening in dogs like it does in horses?
Yeah, well, I would say a lot of times. I'm not quite sure. I'd have to lie, give you an exact percentage. More than 50% of the time, we will have multiple imaging modalities. You know, yeah, I think particularly when we use radiographs, maybe when we just do CT, then maybe less often because it gives us a lot of information already. Um, but yeah, if we do radiographs, chances are that we're going to combine that with something else, unless it's something super simple like a fracture, a cruciate tear, or something like that. Or, I mean, if in an older dog, if we, an exam, we're like, well, there's hip arthritis, there's elbow arthritis, we just use x-rays to confirm and get a baseline so we make sure we rule out anything else. So then maybe it's not necessary to add more imaging to that. But yep, probably more than 50 or a little bit more, we will stack imaging, yeah.
50-ish percentage.
50-ish, yeah, let's use that number, yeah.
That's a very scientific term, ladies and gentlemen. I just got to do a discussion and an article with the veterinarians at Alamo Pintado Equine, obviously centered around horses, but talking about multimodal imaging. But the PET scans are just, because they have one there at Alamo, and it's fascinating because, you're seeing anatomy on so many of the diagnostic imaging modalities, but being able to see what's active and what's not, on a PET scan is so incredible with these injuries.
Yeah, it's fantastic. I mean, so the difference between equine and canine PET scanners there is that we image the whole body, right? So it's used for mostly for oncology purposes, really. Really good at identifying metastatic disease. And so now when we started looking at this, we do see a lot of changes, but we don't really know yet what is normal, what's abnormal. So if you or have a dog that has lameness, they were going to overuse other muscles. And so then they show up. So, yeah, that's what I mean by we still have a lot to learn. There's also lots of options for tracers, and we're just at the beginning of that. And yeah, no, we have definitely we've had some cases where we scan a dog for lameness and then find like a thyroid tumor, for example. And those things are also great because if you find them early, they usually don't become clinical until very late in the disease stage. You help the dog that way. So it's a great tool. The only downside is it's quite pricey, so we
Yeah.
don't do it too often. Yeah.
Yes, they are expensive. They're in the early stages of being more clinically available as well. So another advantage to being there at Colorado State, which is such an incredible facility, there's a lot of amazing tools you have at your disposal, which is fantastic. So Dr. Duerr, you mentioned before, and it got me thinking. You brought up German Shepherds. Are there some breed specific concerns? And I take it from that the answer is yes. Some breed specific concerns that some dogs are predisposed to, and how do you handle that from a preventive standpoint as a veterinarian? I mean, we all know the rumors about German Shepherds. It's like, oh, you're getting a German Shepherd puppy, watch their hips, things like that. But as a veterinarian, are there a few breed specific examples of predispositions that you have the opportunity to intervene early with these joint and soft tissue issues, I guess, to hopefully mitigate that genetic risk?
Yeah, 100%. And I'm gonna start with one that might surprise some of you. Golden Retriever and Labrador Retriever. Number one concern, obesity. So,
Yeah.
if we talk about prevention, not just them, obviously, but that is one of the biggest things that we can do for prevention for these injuries, keeping them skinny. So we'll probably talk about that more at some point. But no, it was mostly joking. The examples like German Shepherd is a great example for. We know that they like to. They are very, very much so a poster child for hip dysplasia. They also are a poster child for elbow dysplasia. They love to get ununited ankle-kneel process. Labradors are probably our poster child for elbow dysplasia. They're also pretty good, again, shoulder OCD, all sorts of OCDs. So then, yeah, the golden retrievers, they get everything, elbows, shoulders, hips, knees. There's actually, I mean, for every breed, there is I'm joking. If you to with our students, orthopedics is really not that hard. If you know the signalment and you know the breed, you can already take a guess, and 80% of the time, you might be in that category, right? So, of where, these dogs will be then diagnosed with afterwards. So the typical German Shepherd, when they walk in the door with a pelvic limb lameness, it's usually either like hip arthritis, there's lumbosacral disease, so neurologic concerns, degenerative myelopathy or stifle disease. And so like those are the things you check. And it's yeah. No, very very strong breed predilections, yeah.
Well, Dr. Duerr, I just made an incredibly wise choice and got a French Bulldog puppy, which is apparently the most genetically breakable dog there ever was. So thanks for that. Appreciate it.
Yeah, well, I mean, the good news is uh, you, I don't know if that's the good news. You probably have more chance of running into a soft tissue problem, but okay, well, let's see how it goes. Yeah.
Yeah, yeah. For those of you listening and not watching, I think he's laughing at me and shaking his head right now. It was a real good decision. We got pet insurance the next day, folks. So there we have it. Dr. Duerr, so we've kind of established, we know our dogs, similar to horses. Obviously, we ride horses, we compete horses, but dogs are athletes, most large breed dogs or even their small brethren are can compete. They can be extremely athletic and agile, and that does tend to equate to injury every now and then. And just like humans, injury and disease, as much as we have come so far in preventing it, it's always going to be a piece of the puzzle, right, that we're going to have to deal with. So in terms of treatment options, sort of specifically to those mobility injuries and disease of joints and soft tissues. Where are we at? Talk to me about treatment options and what do you have in front of you from pharmaceutical intervention to more integrative therapies, whether that be chiropractic or acupuncture or other options, and also nutritional intervention. What are you reaching for? What are your options on the table?
Yeah, so first of all, on the dogs being athletes, that's actually another thing that's very different between people and horses. So I think when people talk about canine athletes, they're thinking about maybe the agility dogs, maybe dog diving, whatever, sled dogs, whatever people might have in mind. But when you think about like every average dog, like their type of daily activity, it's so crazy. It's like they literally, they lay on the couch and then the squirrel goes around, or like the owners come back home. They go from 0 to, 360 in seconds, right? And same with horses, right? They stand in their stall and somebody walks in and, they freak out or do whatever. It's very different than people because we don't do that very often, right? So they put a lot of stress on all their joints, ligaments, muscle. So I think a big difference there. And so I think that actually every dog is an athlete. So um, we feel that, and that's why our program is called orthopedic medicine and mobility and not sports medicine, because sports medicine always seems to be just geared towards those like sporting dogs. But yeah, I think they're all incredibly athletic. So just wanted to put that out there. So yeah, when it comes to treatment, so basically, when I look at treatment and I have this stepwise approach that I share with our students, it starts kind of at what can you do to prevent injuries or arthritis formation, and that includes a lot of things, right? From breeding to making sure that they're of appropriate weight, It also may include things like appropriate exercise restrictions while they're growing. And it may also include surgery at that stage, right? There are some surgeries that we can do for dogs that are affected with hip dysplasia, for example, at an early stage that are pretty minimally invasive and have a big impact and are much easier than doing any other surgery later in life. So that's the kind of the prevention, and we can talk about that for hours too in more detail. So then, when once we are past that, so now we're kind of reacting to whatever has developed. We have this these treatments that are benign, non-harmful, and not super expensive. So we do them all the time. So that is number one in more than 50% of the dogs' weight loss, because usually that's about the number of dogs that we see that are overweight. And then if they are at an appropriate weight, then as part of our nutritional strategies, we like to incorporate EPA DHA, so omega-3 fatty acids or fish oil, how people like to describe it. So that's a, pretty well established strategy. We do like to include some form of joint supplement. There's certainly some controversy about that. I mean, my take on that is that we are trying to, when we look at some of the studies, we're trying to compare joint supplement to a pain medication, for example. That's a little bit of a hard of a comparison, because a joint supplement is meant to do something in the long term, and pain medication is something meant to do right now, right? So it's kind of an unfair comparison to say, I'll take a dog and I'll give him NSAIDs and I'll see how they work, and then I'll use a supplement and I'll see how that works, right? You need to look at it longer term. And since they're benign and there's enough evidence to suggest there is some benefit, I think that makes sense. And then we do something like exercise and maybe environmental modifications. So looking at if we, for example, have a dog that loves playing frisbee and the dog has elbow dysplasia, catching the frisbee in the air and then landing and twisting and turning, that's probably not the best thing, right? So now we got to keep quality of life in mind, and we got to keep in mind what do these dogs live for. So I'm not that type of person that tells owners you're going to have to stop this and you're going to have to only take your dog on 10-minute leash walks. That probably would result in the best result as far as lameness goes, right? Because if that dog is resting the joints, then yep, there's going to be less inflammation, less pain, but it's not really a sustainable quality of life situation. So we try to modify it and then say, okay, well, can we switch to, jogging instead? Or can we switch to, if it absolutely has to be the frisbee, throwing the frisbee and holding on to the dog, and then the dog going after the frisbee so they don't twist and turn, in an unpredictable way. Those type of things. Okay, so now from here on, then we go to the a little bit more let's say aggressive, expensive, and maybe treatments that may have adverse events, right? So when we look at big categories, there's lots of different pain medications that we use. Some of them are a little bit more effective than others, and some of them have more potential adverse effects. So we kind of balance that for each dog, but I do think that a lot of our dogs receive one, like particularly Duerr, it's like the older dogs, 1, 2, 3 pain medications. Um, and then we incorporate a lot of physical therapy. That's I put that in the category of more expensive, because depending on how often you do it, it can get quite pricey. Certainly one of those things that doesn't cause any harm. And people can do some of this at home, so we do prescribe home exercises, but not everybody has time to do that. And then we do include, depending on the location, we do include a lot of modalities that vary on is based on the disease, but anything from, shockwave, laser. Yes, you mentioned acupuncture. We use that as well. Um, and part of that is also trying what works for the dog. And then we do for if we have arthritis, for example, or other problems, we do use joint injections, so various different products that we can use for that. And then when we get to that last stage, again, there is lots of surgeries that can be done to end stage joints as well. So in the small animal world, we can do joint replacements, at least for the hip that's very established. There's joint replacements for pretty much all the bigger joints, but they have a much higher complication rate, so we don't use them as routinely. And there is also some other procedures that can be done. For example, for hips, we have a procedure where we remove the femoral head and then joint fusions, so arthrodesis. That's also another one. So that's kind of what I remember on top of my head of that stepwise approach, but I don't have it in front of me. So people listening, they're probably, oh, he didn't talk about this. I was like, yeah, okay, well, we can get to that.
We're judging you left and right as we speak. No, I think it's so interesting because you talk about joint replacements. I mean, that's obviously something that is not part of our everyday reality in the equine world, certainly. And it's another spot where canine and human may be a little bit closer together on that particular avenue. But so what you just said got me thinking of two questions. The first of which being, NSAIDs, antibiotics, these different drug classes that come into play with canine patients, can certainly have deleterious effects on the gut, just like they can in people, just like they can in horses. And we've learned so much through the last several years in particular about really the importance of maintaining gut health in animals and people. Is that something that you're really looking at or veterinarians now are considering in terms of what they're prescribing with these patients and perhaps taking steps to ensure that the gut is protected when this medication is being administered? So things like prebiotics, probiotics, kind of taking a whole animal approach to maintaining their health.
Yeah, I think it's a super interesting topic, right? There's lots of research out there and lots of interesting ideas and thoughts on how we should be addressing all this. So we're probably a little behind on that in the small animal world and the routine patient. Um, just because there's still a lot of questions on what product should you use and when is it appropriate. I have no doubt that this plays a role. I mean, it's just there's so many things we're already doing, and we're still a little unclear on what's the best strategy. But I mean, there's certainly a lot of dogs that we see that are getting particularly. I guess what I'm saying is if they don't have any obvious GI problems, we probably don't put that on our first item checklist. But there's certainly a lot of dogs when they have GI problems where this is more considered.
Well, maybe they're a little hardier than horses. Bless their hearts and their terribly designed digestive systems. And maybe they're a little tougher than them. But the other thing that got me thinking is, when you talked about the breed specific predispositions, and then you were talking about, later on nutrition and these lifestyle modifications, exercise, rehabilitation, these sort of epigenetic factors. It made me think of human medicine and how much we talk about, yes, there are certainly genetic predispositions to a lot of things, but that these epigenetic factors can certainly make a difference in whether those genes are expressing themselves or not in people. Is that something in your experience or through the research has been seen with dogs as well, that we may be able to intervene and potentially not necessarily divert what is genetically predisposed, but maybe slow it down or delay it?
Yeah, I feel it's another topic where I think there's lots of interest. I mean, I think the future, yeah, lots to learn, But honestly, we're not, I think we're not really there yet, and at least we don't on the clinic floor. So, um, I mean, yeah, well, lots to learn, I guess.
Well, that's the best part about veterinary medicine, right? I mean, and human medicine certainly, but I feel like the pace in veterinary medicine can sometimes be uh, so invigorating because there's constant change and there's constant learning going on, and it's a shape-shifting profession, right? I mean, it can reinvent itself over and over with just one advent of a new discovery. So exciting things. But so Dr. Duerr, I want to revisit one thing for a minute because you are a diplomate of the American College of Veterinary Sports Medicine and Rehabilitation. Rolls right off the tongue, doesn't it? And you know, the rehabilitation, excuse me, strategies that have really evolved through the advent of this college, which is one of the newer colleges in veterinary medicine. I feel like it used to be a little bit more of the Wild West, for lack of a better term, where there was certainly anecdotal evidence that some of these rehabilitation protocols and strategies were working. But now there's a lot more proven protocols thanks to the work of the ACVSMR. So talk to me about that and kind of the progress that can be seen in bringing these dogs back from injuries that they sustained, particularly to joints and soft tissue.
Yeah, this is a this is a great topic, and it's actually one of the things that it's kind of intriguing when you look at this in people as well. The the truth is that it's really, really hard to do to design definitive research studies in this area because there are so many factors that play a role in it. So when we look at let's say, let's pick an example, laser, for example, right? There's gazillions of studies on the laser, what the effects are, and then lots of different animal models and all that. Yet there's still a lot of controversy about this, right? So when should it be used? Who's benefiting from that? Is it more soft tissue? Is it more a joint? What dose? What about the different what about the different, colors of the dogs, all that? There's lots of questions. And when it comes to rehab protocols, so when we're, for example, talking about the post TPLO recovery, right? There is um, still, I think, I mean, everybody uses a little bit of a different protocol. In every case is different. Like the dog has a cruciate tear and then also has maybe not just the other side affected, but maybe also a shoulder problem. So there's not a single best protocol, and there's not a cookie cutter approach to this, at least that what we do in our rehab program here. We have a human physical therapist that runs that, and so she's very specific about, this dog needs this dog needs that. So yeah, I think we've made some advancements and towards modalities, and also some of the exercises, understanding, what level should a water and the underwater treadmill be at and all that. But I hate to say this, but this is another one of those areas where there's still lots to learn. Yeah.
We are ever evolving, folks. I mean, that is definitely the theme of the day, which is a good thing, right? We don't know what we don't know yet, and it keeps things very interesting. And we know that there's constant progress and hope on the horizon to improve over and over again. So, Dr. Duerr, let's zero in on nutrition for a minute, because obviously that's the world that we live in. And a lot of our listeners are big believers in proper nutrition and the right supplementation for their equine athletes. But what about the dogs? You know, we talk a lot about providing the human and the animal with these proper building blocks to nourish their bodies, but also to support, structures like joints and soft tissues. So why is getting a dog's nutrition correct? Why is that so important? I mean, it sounds like a no-brainer in one way, but there are some nuances that some of us may not be considering. And I'd love to get your take on that, and also including weight and also metabolic health?
Yeah, I think that we do actually on that, right? Like we know that inadequate nutrition can cause all sorts of diseases, including orthopedic disease. And so, I mean, way back, people used to supplement dogs with calcium, right? Now, if you do this on a well-balanced diet, you're actually over supplementing them, and that has negative effects. And so, we do know that from studies. We also know that dogs that are overweight are getting more orthopedic conditions, including arthritis. There's lots of great research on that. And so then the other part is we do want to make sure that their diet is well balanced. And so when we see owners or, folks that are trying to do something for their dog by following the newest, latest recipe that's out there. Sometimes that backfires because then we're missing some key ingredients. And so, yeah, we are definitely a big proponents of either a well-balanced diet or if people want to do a homemade diet, then definitely consulting with a nutritionist because even for us, this gets so complicated when you're trying to mix in all the things that are needed on a daily basis. Yeah, I mean, I'm not, I don't have the time for that. Yeah, we are definitely not big fans of that if unless people are working with a nutritionist.
Yeah.
So I think that's one part. We have to provide everything to the dog that they need in their daily ratios. And then in addition to that, we also need to make sure that they are not getting too much, right? That's just a factor of how much exercise are they getting, and then how much are we feeding them? And we all know, somewhat that it's nice to give your dog an extra cookie here and there, and they love it. And yeah, that has a huge impact on them. So I think that's, you said metabolic health. That's, we look at this from the orthopedic lens, but certainly that's a huge part of that. So I think it's same as in people. That's a key part. That's like the number one thing we can start out with, and it's actually not that costly, right? So it's something that we need to do for all the dogs. Yeah. So we check that on every case that comes in, and we give our recommendations. Not that everybody always listens to it, but yeah.
I love that. But yeah, it's so interesting to me because weight, is an obvious factor on joints and soft tissue, that strain, that repetitive strain. But a lot of people don't know that the metabolic dysregulation can have such a negative effect on tendons and ligaments and things like that as well, and we've seen that over and over in horses and in people. And it's sort of emerging more so all the time that maintaining a healthy metabolic state is key, in all of these animals and in ourselves. So that nutrition component is certainly a factor. That's, like I said, the world we live in every day, but I couldn't agree more. It's a big deal. So Dr. Duerr, as we sort of round out here, I would love to have you give us a little glimpse inside of CSU, because I've got a curiosity about your program at CSU. You have such a focus on not only advancing clinical care there, and the actual hands-on your patients daily, but also research, and you have this strong focus on translational medicine through the Translational Medicine Institute. So talk to me about that and what you all are up to in your philosophy at Colorado State.
Yeah, so we love our clinical trials because what we basically do, so we have an orthopedic surgery service, we have an orthopedic medicine service, and the orthopedic medicine service does basically all the non-surgical treatments and recommendations as far as, maybe your dog should undergo surgery or we try this treatment. And so what we do within that service is we test on the clinic floor certain make it joint injections or products or whatever it may be. The rehab protocols you mentioned, it just happens to be that that is very difficult to do and you need a lot of cases for that, so that makes it very hard. But basically, we have a gait lab, so where we use a pressure sensitive walkway. So we measure exactly how much forces the dogs are placing on each leg, and um, we try to make it a little bit more objective, as far as like how much is a product actually contributing to the dog's well-being by measuring that. And then they wear these activity collars that measure their daily activity. And then we do a vet exam, we do specific examinations there. And then we have owner questionnaires that we use, and all that being put together gives us actually a pretty good idea of what the impact of this is. Now, there is a huge caregiver placebo effect. So, caregiver placebo effect means that not only the owner but also the veterinarian are biased towards believing that their dog will get better when they get a treatment. So we know that that's at least 40%. So probably much more in a non randomized setting. And so basically what we try to do is, in an ideal world, we try to offer our owners to enroll in a study. And that study generally will be something where we look at, let's make it some simple like PRP. Does PRP help your dog with elbow arthritis? And so then our treatment group would be PRP, and our control group would be something like a gold standard. So for example, hyaluronic acid, something like that. Um, and so then we would compare these two and we would look at, well, which group objectively is doing better. And that type of research is helpful not only for dogs, but it's also helpful because we can use that to extrapolate for people. And there are there are some products, for example, stem cell therapy is one of them where it's much easier for us to do research, CBD, those type of things. That's something where we have a little bit of an advantage over human medicine. The unfortunate thing is that dogs don't live as long as people. And so when we look at a long-term thing study, so for example, does a certain joint supplement help? If it's in a person, you'd have to run that study for 20 years or so. And in a dog, you only have to run it for 2 years, 3 years. So there's a huge translational opportunity there because the dog has been shown to be a pretty good model for people. Now, and the reason why we love it is because by doing these clinical trials, we offer our dog owners sometimes new treatment options, and also we help them financially by covering the treatment costs. So basically, it's a win-win. The dog benefits ideally from the treatment. Of course, we don't always know what a new treatment does, but that's our goal is to select treatments that are helpful for our studies. And then we also contribute to the veterinary literature and hopefully at some point also to what affects people.
I love that. And one thing I love about talking to you, Dr. Duerr, is you're always excited about your profession. But why veterinary medicine? And why this corner of veterinary medicine? Why is this, what you stay hungry for?
I mean, I always joke when people, say, they talk about their jobs and, this is not right and this is not right and this is not right. And I walk into the clinic and there's a dog that looks at you and wags his tail and, jumps up on you. I mean, I don't know. How could it be better than that? I mean, it's just a fantastic job. And we help we help the owners as well. You know, they hate seeing their dog limp around, and yeah, the research that we do is hopefully meaningful. So I don't know. It's really not a job. It's more like I'm lucky that I get paid for my passion. So
I love that. And you don't have to question whether you make a difference every day, which is, universal in veterinary medicine, but I think that's pretty special. So, well, there you have it, ladies and gentlemen. I mean, a look into the world of canine mobility with one of the veterinarians at its forefront, Dr. Felix Duerr. So thank you all so much for your insights, sir, and for joining, me and our listeners here today to kind of give us a real, like I said, an insider's glimpse of what it is that you do every day and kind of the nuances that make it unique to dogs versus the large four-leggers that we're typically talking about here. So it was really wonderful to be able to learn from you. So thank you for joining me.
thank you for having me. It was a great pleasure.
And to our listeners, I hope you all learned as much as I did. And thank you for joining Dr. Duerr and I on the It Starts Within podcast. And from myself and all of us at Platinum, we hope you join us on the next one. So until then, take care all.